Welcome back here to New Day Cleveland. Does the current environment have you feeling a little anxious? A lot of people seem to be feeling that way these days. Well, here to help us out is Dr. Afsarifard. He is the clinical director for Premier Behavioral Health Systems, and he's joining us this morning. Thank you, Dr. A, for being here with us.
Thank you. Thanks for having me.
I think, anxiety is something that a lot of people live with on a daily basis, but when you bring in a global pandemic into the mix, I think that really, those who might already be dealing with it, it could escalate it. Those who've never dealt with anxiety before might start developing some.
That's very true. Anxiety is something that's been around for a long time, about 70, 80,000 years, and it's actually helped us survive as a species. And I always tell people anxiety is a reaction to difficult situations or challenges that we have. And it's like salt. A little bit of it is good, and if you have too much of it, it's going to create problems. And when you have just enough of it, it helps us motivate ourselves to get things done, to face challenges with some energy and motivation. But when it gets past that and you have too much of it, it can really impair our ability to deal with even day-to-day challenges of life.
Now, is this something that you help your patients with, I'm guessing, on a regular basis?
Yes, anxiety, unfortunately, it's a pretty common problem. The statistics on it is that basically you have 14% of people in the course of a year long, they have an episode of anxiety. And lifetime episodes are about 25% for people. So it's a common problem, but fortunately, we have really good treatment for it. And it's something that people seek help for. And the sooner you seek help for it, the better it is, because like any other problem, if it's left alone, it's going to get worse.
Well, and I think some people can have a lot of pride. They worry about, if taking medicine makes me seem weak because I have this condition. But when people aren't seeking the help that they need with the anxiety, I mean, what can that really lead to? What does that turn into?
Well, anxiety is basically our mind working against us. And the more you let it sit there and not address it, the stronger that negative thinking is going to get. And we become really good at stinking thinking, and it just creates more problems and affects more areas of our lives, like work, family, relationships. And the treatment for it is basically using a combination approach for taking medication and behavioral management. In the earlier parts of it, the behavioral management and using uh, ways to change our thinking and change our behaviors can be really helpful. But if it sits for a while and it becomes a more chronic problem, use of medication along with psychotherapy and these interventions can be really helpful in getting rid of it.
So you are mentioning that anxiety, having a little bit of it, isn't necessarily a bad thing. So when do you think people should go and see a doctor? I mean, where is there a point where you realize, okay, maybe this isn't just a good thing anymore. I really need to seek some help.
Again, by definition, when it starts interfering with different parts of our lives, when people start using ways to try to control the anxiety, there are usually three major ways: that trying to make everything perfect and trying uh, to use repetitive types of behaviors to deal with this anxiety, and also the negative thinking, to trying to predict more negative things that could possibly happen. That we call this the what if syndrome. They just keep thinking, what if this happens and what if that happens? And the average person thinks that this is something that they're doing to plan for difficult situations, but the mind gets really good at looking for problems and actually creating some problems, because if we have a good mind, it is going to work that way.
Well, Dr. Farshid Afsarifard again joining us from he's a clinical director for Premier Behavioral Health Services. It's a very important topic. I'm really glad you were able to come on and speak with us today. And if you're someone who's going through that and needs some help, now we know the experts are there for you and will be willing to help you out. Thank you so much for joining us this morning.
Thank you very much for having me.
Good day.